Hey everyone, welcome to our channel. I am Gaurav, a physiotherapy intern from Maharashtra, India. Today we are going to discuss GCS, that is Glasgow Coma Scale. But before diving into the video, for more such contents, subscribe to our channel. So Glasgow Coma Scale evaluates the level of consciousness of a patient who has sustained with head injury or having any other neurological conditions. Basically, it measures whether the patient is conscious and oriented to his surrounding. So this scale consists of three main components, which includes eye opening, verbal response and motor response. Maximum GCS score is 15 and minimum is 3. It is never 0 or 1. If the patient is having maximum score that is 15, then he is completely normal. If the patient is having minimum score which is 3, then he is having severe head injury, but minimum score of 3 is rarely possible. Now let's break down each component in detail. Okay, so for eye opening, the maximum score is of 4. For verbal response, the maximum score is of 5. And for the motor response, maximum score is of 6. In this way, we are having maximum score of 15. Now let's discuss about eye opening. So in eye opening, the maximum score, which is 4, indicates spontaneous eye opening. The score of 3 indicates eye opening to speech. The score of 2 indicates eye opening to pain or any pressure sensations, and at last score of 1 indicates no eye opening. It means that when you are approaching towards the patient in your ward or in ICU and the patient spontaneously looks at you, then he is having maximum score that is 4. But if the patient is not spontaneously looking at you but looks at you when you talk to them or ask any kind of question to them, then they are having grade 3, that is eye opening to speech. If the patient is not even responding to your speech, then you can apply a pressure sensations over the nail bed or pain sensations, and when they look at you, then they are having grade 2, which is eye opening to pain. And at last, patients doesn't open their eye at all. Even if you apply any kind of pain sensation, then they are having grade 1, which is no eye opening. Our second component is verbal response. So verbal response assesses the patient's ability to speak and communicate. This means after head injury, whether the patient is able to speak properly or not, that we see by using verbal response. So as I said, verbal response has maximum score of 5, which indicates normal conversation. This means that patient communicates with you normally and he seems to be completely normal. But if the patient seems to be a bit confused while talking, means he is able to talk but he is confused and disoriented to his surrounding, then he is having score of 4, which means confused speech. Patient has grade 3 if he is having inappropriate words. It means that he is speaking in words and not in sentences. He is not able to integrate the sentences, so he is just using some kind of words. So if he is using such kind of words, then he is having grade 3. Grade 2 in verbal response indicates incomprehensible speech. This means that patient is not able to frame any kind of sentences and words. He is just making some kind of sounds. If this is the case, then give it a grade 2. And at last, grade 1 indicates no verbal response. At last, talking about motor response evaluates the patient's ability to perform movements in response to stimuli. As I said, it has maximum score of 6, which means obeys command. In this, we ask the patient to show their tongue or else do the finger movements, and if he is able to do so, then he is having maximum score that is 6. But if the patient is not able to do such movements, then you can apply some kind of stimulus. Like for example, you can apply pressure over the upper trapezius muscle and see for the response. If the patient is able to localize pain, then give it a grade 5, that is localizing pain. If the patient withdraws from the stimuli, like makes any movement away from the stimulus, then give it a grade 4, that is withdrawal response. If the patient flexes the extremity where you are applying the pain sensations, then give it a grade 3, that is flexion response to the pain. And if the patient is having abnormal extension response to the pain, then give it a grade 2, that is extension response to the pain. And at last, grade 1 indicates no response. At last, we will add scores from your eye opening, verbal response and motor response and see what is the maximum score of the patient. If the score is between 13 to 15, then patient seems to be normal, that is he is having mild head injury. If the GCS score is between 9 to 12, then patient is having moderate head injury, and if it is less than 8, then he is having severe head injury. In summary, Glasgow Coma Scale is an important tool for assessing the patients with head injury or any neurological condition. By taking the GCS score into consideration, healthcare professionals can better understand the level of consciousness of the patients and tailor the treatment protocol accordingly. So that was all from this video. I hope you will find this video valuable and informative. For more such contents, do subscribe to our channel, like this video. Till then, see you soon in the next one. Take care. Bye bye.